to go the other direction for compressing that, okay? So then you can also have your arm underneath here like this, compress the areas going through the regions. You can also just relax the arm like this, compress it, just a little bit different position, make it feel a little bit comfortable for you. Okay, for the scapula region, what you're going to do is you're going to bring the arm like this and actually come underneath the arm like this. And you can see how the scapula kind of sticks out. But when you're holding down right here, you can actually stimulate those areas then too. So you can actually do a little rocking too with it. But again, look at their fingers and their toes, whether it's too uncomfortable for them. So it all depends on what they prefer for that. Okay? And sometimes clients are going to help out a lot too, so you can just tell them just relax during it, but just make sure you're aware of any injuries. So it's always a good idea to actually have them fill out a health form beforehand, so you make sure you don't push too hard on injured areas, but just make sure you evaluate that as much as you can then. Okay. For the glute region, remember the gallbladder and then also the bladder meridian actually runs through this region, but you can actually stimulate with more of your knuckles, okay? You actually do more of a twist right in there too then, okay? Then you can also interlock your fingers like this, and right around the sacrum right here, you're actually going to compress right here then, okay? Just compressing right on the sacrum. And that's actually really good points for when the woman is having their menses, her period. So that's the areas you want to concentrate on a lot, because of course with anything in the abdominal region it's going to be a little bit discomforting. So right around this area, right around the sacrum, and actually on the sacrum a little bit, that's the areas you want to concentrate on. But of course the tailbone, the coccyx, you don't want to put any pressure on that because you can actually break that off if you add a fair amount of pressure then, okay? So just make sure you're aware of where the coccyx is, make sure it's more the sacrum region that you're concentrating on then, okay? So for the glute region, you can actually lift up the foot like this, and you can actually kind of rock it too, okay? So just rocking it like this. So again, it's adding a little pressure, but it's a little bit easier on yourself because whenever you move the muscles around, it's going to stimulate those areas a little bit easier, so it's going to be a little bit less pain for yourself then, okay? Okay. Then also, for the leg area, you can actually have the leg up like this, so you're actually stretching out the quad region a little bit. So you're actually stretching, and then you're also compressing at the same time then. But of course, any bony areas, they're more likely to bruise, so make sure you don't put a lot of pressure in that region. And another thing to be aware of too is always ask women, and sometimes guys too, for varicose veins, because if they are wearing sweats like this, you're not aware of where the varicose veins are, so you want to actually ask them to make sure you're not putting a lot of pressure on the varicose veins then, okay? So again, another endangerment area is right behind the knee right here. Okay, so that's the popliteal, okay? And there's actually a posterior tibial nerve that actually runs through there, and you can actually damage, and you can actually get some tingling in their feet if you damage that area. So again, don't put direct pressure right in the popliteal area then, okay? So again, the kneecap is actually called the patella. This is called the popliteal fossa region, okay? So you can actually kind of compress, kind of squeeze this area if you need to then, okay? Okay, so you can actually perform a little bit of stretch too, like compressing, going down. Kind of like a ratchet too in a way if you want to look at that, or kind of pumping. You can also sit on the edge of the table here and actually compress going down too. This works really nice. You can also kind of give them a little pull too, okay? Hold on to the leg and just give a little traction. Just different areas holding on to as you're going up then, okay? Okay. Then you can also compress, extend, compress, extend kind of thing. You can also do a little circular motion. Okay. because you know some of you get pretty bored with this compressing on areas on the leg or anywhere in the body. So you can add a little bit of movement, and it's actually relaxing. You can actually see if the client's relaxed.